economic, the social impact of migraines is bigger than any other disease burden in the world. Today I want to talk a little bit about a topic that may be a little bit of surprise for people to hear that a facial plastic surgeon is speaking about, but that is migraines. So migraines is one of the most ubiquitous conditions in the world. Even though medical therapy is the mainstay, over the last 20 years or so, there are other aspects of this disease or condition that has led to the development of more interventional procedures which actually benefit patients who are no longer responding to the traditional medical therapies. So we know that the migraine brain is genetically predisposed, a little bit different than a brain that doesn't have that condition. So for example, I don't have migraines, but my wife, my sisters do. So there's a genetic predisposition in those people to be super sensitive to a variety of different things. So the problem in migraines is in the brain. We know where the problem is. We also know that there are areas outside of the brain and conditions outside of the brain that either precipitate a headache or potentiate a headache or perpetuate a headache. So the 3 Ps is what I call that. And things could be, for example, like the weather. It could be perfumes, it could be smoke, it could be stress, it could be diet. A lot of different factors contribute to making the system, which is already super sensitive, get to the point where it is no longer adapting in a healthy way to these different stimuli. And we have found that there are things that we can do to change the input to the brain and give the brain a break. And that includes nerve blocks, infusions of certain drugs, and surgery. And that is something that I have become very interested in the last 20 years. And in fact, in our state, in South Carolina, I do more of those complementary treatments and procedures than anybody else. So I work in tandem with the neurologists, because again, the problem is in the brain. I'm not a neurologist. But those patients who are no longer responding or who have been on 10, 15 different medications over the course of many years and have tried everything and nothing is working anymore. There are things that we can do that actually resets that system and then allows some of the things that didn't work before start working again. And there's a whole myriad of things that we can do to help people who are literally incapacitated, can't work, miss work, miss school, and that has been one of the most gratifying things that I've been involved with over the last 15 to 20 years. People often ask, how did you get into this? Or why would a facial plastic surgeon be involved with that? And the reality is that it was always in the background because of family members. So my wife has migraines and my sisters do. So I was always sort of thinking, I didn't know much about that other than I saw what they were going through. And then over time in the literature, there became more and more evidence of things that were extracranial, right? So outside of the brain or outside of the skull, that seemed to be related to the networks and the systems that were creating this sensation of pain in migraine. And because of my head and neck surgery expertise, and that's what I'm trained in, it became a very easy jump to some of the procedural things that started coming about when I first started getting involved and now are very well established. So for me, it was kind of a natural progression in terms of one, interest, because I wanted to help my family if I could, and two, just intellectually stimulating and also part of technically things that I was doing anyway for other reasons. So for example, surgery for migraines is something that is now pretty well established. And the reason behind that is that there are areas outside of the brain that we can manipulate that will then decrease the input to this system, which is overstimulated. And it all started, or the idea sparked behind this was there was a surgeon who was doing endoscopic brow lifts and noticed over time that a lot of his patients, they were pleased with their aesthetic results, but they also were having less headaches. And he started noticing that, and eventually that led to a change in the technique for brow lifting that then was adapted to decreasing the pain of migraines in people who had a particular area involved. So it was a serendipitous finding, really. He was just an astute surgeon who was listening to his patients, and that led to a whole litany of things that we now do almost routinely for patients who are not responding very well to their migraine medications. As far as treatments for migraines that I do, there's a variety of things. And they range from nerve blocks, which are literally injections to particular areas of the head, where we know where the anatomy is. We see those in surgery for other things. There are IV infusions, where we give certain drugs in concert with these nerve blocks. And then there's actual surgery, where we go in and decompress these nerves, and we do a variety of different things that are invasive. So there's a protocol that I follow that starts off with non-invasive things leading up to invasive or surgical option. But again, this is not for every migraine patient. These are for patients who are at a point where they've either plateaued with their medicines and are not getting any results, or they are just not having the quality of life that they need or that they want because things are just not good enough. People missing time from work, people being fired because they've missed so much time from work, and or missing school, or missing time with family, all the things that we hear that eventually either the patients seek us out or the neurologists will seek us out to see if there's something that we can do to get that patient back on track for some of the more conventional things.